Center has written a letter to states and UTs regarding the decline in testing. Although, what are the guidelines we are following for testing? Can you just elaborate on that, sir? Because it has been a little confusing for people and for the institution as well. So, could you just clear out what are the guidelines to be followed?
Okay, testing is a public health tool by which you characterize an epidemic. However, that does not mean that a particular state should test anybody and everybody. That is not a testing strategy, a testing approach. So when we do a test, there is a purpose behind it. So the way epidemic was behaving in 2020 January is very different from the way it behaved in, let's say, January 2021. And then now we are in January 2022, the nature of the epidemic has changed. We know that Omicron is the variant circulating and it is replacing Delta. And it is spreading so fast that many people are getting infected all around. And most of them are asymptomatic. Right. So if the limited number of people are who are infected with Omicron variant are asymptomatic and you get to know about them, you can always with a correction factor, figure out what is the total number of infected people. So it is not a must to do a head count in terms of testing everything. But the state should not lower down the testing, the performance in terms of the number of tests done amongst the symptoms. Because the moment we know what is the situation in terms of those who are symptomatic and they get tested and they're positive for SARS-CoV-2, and how are they doing in terms of clinically? That's very important because that will be reassuring if you can see that most of the infected people are becoming all right at home and they need not to rush to the hospital. And so the healthcare burden would also be less. So that's why the center has appealed to the states to ensure that sufficient number of tests are happening. But that does not mean test anybody and everybody. So the recent testing guideline clearly says that the asymptomatic contacts of symptomatic individuals need not get tested. But as they have somebody in the family who is symptomatic, they should try monitor their own health. And if they are not running out to be symptomatic, fine, but they should use masks while they are in the family or in the public place. On the other hand, those who are symptomatic can do the home test or rapid antigen test. And if that test turns out to be positive, then there is a very easily comprehensible or understandable home-based care guideline